All right, so now let's actually get into the organs that are going to be part of this GI tract. We're going to get into it in detail. So we're going to start with the mouth, the pharynx, and the esophagus for this video. We're going to talk about the mouth, including the accessory digestive organs we find in the mouth. We'll talk about teeth. We'll talk about swallowing and the role of the tongue, the upper esophageal sphincter and epiglottis play in that. And then we'll also talk about the pathway food follows as it goes down from the mouth towards the stomach. So let's talk about the mouth, or also known as the oral cavity. We have various components to this. We're going to go ahead and talk about them all. We have the labia, also known as the lips, the labial frenulum, the oral vestibule, the fauces, the gingivae, the hard and soft palate, and then the palatoglossa and the palatopharyngeal arches. So if we look at these guys, right, so we have the superior and the inferior lips, the labial frenulum, we have one up here and one down here, kind of connecting your lip to your gums, basically. The gingivae, which are your gums, right? All the various teeth. You have the incisors in the front, kind of the flattened, kind of skinny ones. The cuspids, which are your canines. The bicuspids, and then the premolars and the molars. Right, molars are getting more flattened out, right, as you go back. We have the uvula, which is this part that is going to kind of hang down. The open space here, which is going to be the fauces. The palatopharyngeal arch right here. The hard and the soft palate. So hard palate's going to be like right at the roof of your mouth. Soft palate's going to be further back towards your throat. The oral vestibule right here. It's kind of like a pocket. And then we have the opening duct to the submandibular gland. So you're going to have ducts that go to the basically salivary glands. We have the lingual frenulum, which is going to connect the tongue. So if you were to like look in the mirror and stick your tongue out and kind of stick it upward, you would see the skinny piece of tissue that's kind of rooting the tip of your tongue closer to the bottom of your mouth. That would be the lingual frenulum. And then from this angle, we can actually see the palatine tonsils, right? So when you think tonsils, you're usually thinking palatine because those are the ones that you would see in the back of your throat. When we talk about the tongue, this is going to help with ingestion. So it's going to help you basically eat, chew your food. It's going to help with some sensation, right? You're going to get the taste. You're going to get temperature, right? Things of that nature. And then also speech. It's going to help you form sounds, right, so that you can talk. And then it's going to help move food around so you can chew it thoroughly. It's going to form what's called a bolus. That's going to be your chewed up food. And then it's going to push that bolus back so you can swallow it. We have very powerful skeletal muscles here, right? The tongue is just covered in papillae for us to be able to taste the food that we're eating. And then again, that lingual frenulum is going to anchor it down so it's not just flopping all over the place, right? It's kind of like the rope that ties it down so it doesn't go too far away. So here's our basic drawing of the tongue. Here's at the very back, we see the epiglottis, right? The palatine tonsils. The lingual tonsil, which is like at the very back of the tongue. We have the terminal sulcus, which is kind of right where that tonsil and tongue meet. We have the foliate papillae, which are the very back. We have, that are right on the edge there. We have the circumvallate papilla, which are going to be at the very back. The fungiform ones are kind of mainly here, and then the filiform are like at the tip. And then the dorsum, this is like the top side of the tongue. Now, helping the tongue and the mouth out are the salivary glands, which we have a few different ones. We have the submandibular, the sublingual, parotid. So, submandibular, sublingual, those are both named for where you find them. You find them under like the mandible area and under the tongue. And then the parotid will be off to the side. And they're all going to help with secreting saliva. So here's our nice picture. So we see the sublingual salivary gland and the ducts that are going to reach up kind of under the tongue there. We have the submandibular salivary gland that's coming kind of down below that and around. And then the parotid salivary gland is this chicken nugget looking one right here, with its duct going towards the mouth as well. The saliva is being produced by these salivary glands. It's mostly water, almost completely water, but it can vary in consistency from serous, which is going to be like really watery, to more mucus, where it's a little bit thicker, right? You've probably noticed on occasion changes in your saliva, right, depending on the situation. And the saliva is going to have all sorts of things mixed in it. Ions, enzymes, antibodies, growth factors, all sorts of stuff. But the big one that we care about is salivary amylase. This is going to start to break down carbohydrates. So as soon as you start eating the food and you're chewing it, it's going to start to break down carbs. This is all controlled by your autonomic nervous system, which, if you think about it, makes sense, because if you're just hanging out, you'll notice your mouth is, normal amounts of saliva. But if you get scared or nervous, right, and your fight or flight response kicks in, you notice your mouth gets kind of dry, right? So you can kind of, if you think of it that way, you can think of, oh yeah, that makes sense. The autonomic nervous system controls saliva production, or at least saliva release. Now we also have teeth. Now as a baby or as a little kid, you have 20 of them. We call them deciduous because you can lose them. So those are your baby teeth. And then you end up with 32 permanent teeth, 8 incisors, 4 cuspids, 8 premolars, also called bicuspids, and the 12 molars. And so this is where we would find those, right? So we have the baby teeth in the middle here, and then the adult teeth at the very top and the very bottom. I'm not going to worry so much about the teeth, but if you're going into like dental hygiene, into a dental hygienist program, I would say take a little bit more time with these ones. Although you probably already kind of checked these out if that's your pathway. With the molars too, so we said that there's 12. Many people get some of these taken out though, because that third molar, the last 4 basically, are your wisdom teeth. And so a lot of us don't have the room for these actually, because our jaws have gotten smaller over time. And so many people need to have them surgically extracted, right? And some people are actually finding that they don't have all 4, or they don't have any. It is something that is kind of sort of disappearing. So some people will find they only have 3 or 2 of their wisdom teeth. I, on the other hand, have all 4 of mine. However, I'm a strange one in that I have room, and so mine are doing just fine. But this is, I guess, the one part we will care about, which is the anatomy of a tooth. We have the crown, which has the enamel, the neck, which has the dentine and the pulp cavity, and the root, which continues with the dentine and the pulp cavity. So here are the components: the crown, the neck, and the root. So the crown is what you see, the neck is what's kind of underneath the gums, and then the root, that's what's going to be all the way down into your jawbone. So the enamel is the very outer edge, the dentin is going to be below that, and then the pulp cavity, which is going to be the very inside, and that's going to be very sensitive, right? Because you have blood vessels, you have nerves. If someone has a problem here, it can extend all the way down into the roots of the teeth, and this is where someone may need like a root canal. We also have little ligaments called periodontal ligaments that hold the teeth in their place, as well as like the gums that are going to kind of cover those edges there. If you remember back from the joint, the articulations chapter, we talked about the specific type of joint we have here, and it's the gomphosis joint. All right, getting to the pharynx. We can break the pharynx down into 3 regions: the nasopharynx, the oropharynx, and the laryngopharynx. They're all responsible for the same things, with the exception of the nasopharynx not helping with digestion. I don't recommend trying to eat with your nose, since the nasopharynx connects with your nasal cavity. So we just see the regions here. So we see the nasal cavity in blue, the nasopharynx connecting at that blue point in purple, the oral cavity shown in pink, and we see the oropharynx shown in purple as well, and the laryngopharynx coming down connecting to the larynx So wherever you see those colors connecting to the pharynx, that region of the pharynx is named after the cavity it connects to. And then we get to the last thing we're going to talk about in this video, and that's the esophagus. This is just a very muscular tube that's going to connect our pharynx down to the stomach. The upper 2/3 have skeletal and smooth muscle, but the bottom third is going to be smooth muscle only. This is what's going to start peristalsis, that rhythmic contraction, right? So that we can purposely and easily move food from the mouth area down towards the stomach. There are upper and lower esophageal sphincters, and we are going to be made of non-keratinized stratified squamous epithelium. There is no serosa since we are not in the abdominal cavity, so instead of the serosa, we call it the adventitia. And so this is just what we see here. And keep in mind too, the esophagus is going to be behind the trachea, so it's going to be more dorsal, right? It's going to be on the dorsal side compared to the trachea. If we look at where we have the sphincters, here is the upper esophageal sphincter up in the throat area. The lower esophageal sphincter is going to be down right near the stomach. And so this is where we're going to get into what we call deglutition, which is just swallowing. And I'll just say swallowing. There is a voluntary phase and then two sides to the involuntary phase, which is the pharyngeal and the esophageal phase. Both of which, again, are involuntary. It's part of the autonomic nervous system response. So let's talk about what's going on here. So we have, we're basically pushing this food, right, this bolus that we've chewed up, back with the tongue towards the throat, right? We're going to have some muscles that are going to constrict, that are going to basically block off the nasal cavity. So we're going to block off the nasopharyngeal area so we don't have anything come up into the nasal cavity. And then as we push that down, we're going to see this epiglottis fold over to block the trachea area so we don't get anything in the airway. And then once it gets down here, we have the muscles that are going to help contract in that wave-like motion to cause us to go all the way down. I'm not going to be as worried about you memorizing the muscle names right now, but at least knowing the basic process of, like, we need to block the nasal cavity so we don't have anything go in the nose. We need to use the epiglottis to block the tracheal area so we don't have anything go in the larynx and the trachea or the airway, right? And then use that rhythmic peristalsis motion.